Hi, it's Dr. Osborne. I just wanted to go over your hip routine. This routine we designed just specifically for you, and what it's going to do is it's going to increase range of motion, increase flexibility, increase strength, and increase coordination. So this is a kind of a next level hip routine for stabilization so that you can kind of take your care up to the next level. So the first thing that we're going to do is realize that it's going to be a full body exercise. And we're trying to address the entire body as we always do. So the first thing that you're going to do is we're going to do our elbows, our elbow exercises. As we do these, you're going to keep your chest up, keep your elbows level with, your arms level with the ground, and we're going to bring your elbows in and touch together. And so you're going to do 25 of those. The second thing that we're going to do is we're going to do what's called cross crawl. We're going to do 10 of these, and we're going to do 2 sets, meaning that you're going to actually take a break and then rest for a second. So what the cross crawl is going to look like is you're going to lay on your back on the ground, and you're going to bring your left hand up, and you're going to bring your right knee up at the same time. As you're doing that, you're trying to lengthen your arm as high as you can, and then you're going to bring it down at the same time, and you're going to alternate back and forth. So you'll do 10 of those. And take your time with those. Make sure that you're lengthening out the spine. The next one that we're going to do is what we call the pillow squeeze. I don't really have a pillow, but I do have a teddy bear here. So the reason why I'm letting you see this is I want you to realize you can really use anything. We're going to put our knees together, our feet hip width apart, and we're going to squeeze our knees together. And we're going to count 1, 2, 3, relax. 1, 2, 3, relax. 1, 2, 3, relax. Make sure that you're symmetric, meaning that sometimes people will squeeze the knee together because they have a stronger leg. So if you do find that you're squeezing more on one side than the other, actually overcompensate and squeeze on that weaker side there. That one is going to be 10 times. The big key on this one though is as you're squeezing, keeping your palms up and trying to stretch your hands out as far as you possibly can. What that's going to do is that's going to stretch out the mid-back. It's going to open up the chest there. Next one is going to be knee drops. Knee drops are going to be nice and simple. Right after we do our squeezes, we're going to keep our feet on the ground, palms out, head up, and we're going to turn our pelvis to the side and just letting those knees drop down. We're going to go from side to side, nice and relaxed, letting it stretch out on the side of your legs, let it stretch out on the side of your body there. And we're going to go 10 sets, meaning that 1, 2, that's 1. We're going to go back 1, 2, that's 2. So in doing that, we're going to do 10 repetitions for 2 sets on that one. Next one is going to be what we call the hip crossover stretch. And this is going to be one of those ones that is absolutely critical that you get the right posture and position in. So the first thing that you're going to do is you're going to take your ankle and put it on your knee. Then you're going to roll over sideways so that your foot is actually pointing in the direction of your lower leg. You're going to take your hands, you're going to put them out and push them straight out like you're stretching out, but you're going to take your knee and you're going to push it down in this direction. As you're doing that, you're going to feel your low back arching. So it's pushing out, knee down, keeping your foot firmly planted on the ground. Don't let your foot come up in the air. So keeping your foot down, pushing your knee, stretching your arms out, and letting that low back arch. I want to warn you, you might feel a little bit of cramping when you do this one. Don't lose the position. The cramping is the muscle shortening up and actually changing and actually activating. So you're going to do this one for 1 minute on each side. The next one that we're going to do is the classic cat dog exercises. Key on this one, keeping your shoulders over your hands, and then we want to keep our knees right underneath our hips. The mistake most people make is they do this or they'll do this. We're going to start here. You're going to drop your head down and you're going to lift up as if you have like an ice pick underneath your chest. And then you'll drop back down. And when you drop down, we're not putting all the pressure right here. It's as if we're dropping our chest down here, letting that belly drop down. And then you're going to come back up, and drop back down. This is a great exercise. I prefer that you, a minimum of 10, but ideally we like to have you about 25. It's a full body exercise, strengthening, making sure though that as you're dropping down, you're contracting those low back muscles. As you're raising up, you're contracting your abdominal muscles right here. The next one, you can call it whatever you want. It can be Superman's if you're a man, it can be Superwoman's if you're a woman. But in this particular exercise, we're gonna come into this position. We're gonna have our hands out straight. And then we're gonna bring our arms and our legs up. We're gonna hold them, we're gonna have 10 repetitions for 5-second holds. Mistake most people make is they try to come up here and they'll feel a lot of pressure in their low back. This is an exercise for the mid back, and so as you're coming up, keeping your head down and lifting up, pointing your hands and pointing your toes. We're also gonna, the next phase of this is what we call opposite hands, opposite legs. So we're gonna come up, we're gonna raise the right hand up, left leg up, and we're just gonna alternate. We're gonna do 10 repetitions, once again for 5 seconds. The last one, sometimes people find this to be one of the most difficult exercises, but as we're standing, what I want you to see is that we're gonna do toe raises in 3 different directions. The first one's gonna come straight up and down. The second one is gonna go with your feet out. So we're gonna come up and down with our feet out. And the third one is we're gonna go with our toes in. Now, a lot of times people make a mistake where they will do their toe raise and they'll do this. So they're not necessarily raising their toes, they're just bringing their pelvis forward. What I want you to think about is contracting your abdominal muscles, keeping everything tight in here, keeping your palms out, and raising yourself straight up and down. It should be done in a coordinated manner. It might be very difficult at first, but just take it slow. Second one, toes out. It's almost like you're a ballerina, and you're coming up once again, trying to keep your body as still as possible. Third one, toes in. This is a difficult one, but once again, you'll start to feel it starting to unlock in your pelvis. You're coming up and down. Look, just like any other exercise or anything that we talk about, it takes time, repetition, and energy. There's no process that doesn't take time. So if you're finding it difficult, give it time. It's a progressive exercise that over time, days and weeks, it'll slowly progress and allow you to have the stability and the strength that you need to be able to continue on. If you have any questions, make sure you always talk to our team. Any challenges, you can always email us at info@drtjosborne.com. Have a great day, and make sure you never give up. Happy day.